Good afternoon. My name is Joseph Lee. I'm here to introduce Dr. Sun Woo, but I'd like to tell you why I decided to invite him here. See, I'm in high school now, but before I was in kindergarten, I was diagnosed with sleep apnea. For those of you who don't know, sleep apnea is caused by some sort of obstruction in the throat while you're sleeping. For me, the symptoms were serious. My face would go pale, I would stop breathing, and I would sometimes have seizures. After a year of suffering these symptoms, I got my tonsils removed. Most of these symptoms stopped. A few years later, I went to Dr. Sun Woo's office for orthodontic treatment. But there I learned that an orthodontist does more than just straighten your teeth. It turns out that orthodontic treatment could be a useful treatment for sleep apnea, which gave me a lot of hope. Now, not everyone here may be afflicted with sleep apnea, or not everyone may know someone with sleep apnea, but maybe you know someone with difficulty breathing, or someone who snores, or someone with asthma. That is why I invited Dr. Sun Woo here today. Maybe his talk will influence someone in your life, maybe a friend, a coworker, or yourself. Thank you.
我们接下来请 Dr. Sun Woo介绍讲一下呼吸系统跟矫正的这个治疗，这是一个很专门的一个医学的东西，所以呢非常感谢，谢谢大家来，我们请 Dr. 你开始讲。
Yes, thank you. Sorry, my Mandarin is not good, so I'm going to do this presentation in English. So thank you for having me. Thank you, Joey. Once again, my name is Dr. Michael Sun Woo. I'm an orthodontist. I work with Dr. Paul Lee in Cupertino and in Milpitas. Dr. Paul Lee would have loved to be here today, but unfortunately he had a family emergency and could not be here. But, I'm sorry. Okay, so just a bit of background. I went to USC Dental School, and then after graduating dental school, I spent 4 years in the Army as a dentist, and then I completed my orthodontic training at Harvard. This is my family here. Well, this picture is old. This is about 2 years old. In December, we actually welcomed the newest member of our family, our baby Miles, and so pretty busy. He keeps us busy, but it's been a blessing at home. So thank you. So today I'm going to be talking about the airway, breathing, and how orthodontic treatment can actually affect your airway, how you breathe, and indirectly how you sleep. So in order to do that, first I'm going to show you 4 patients. And all these patients presented to our office for orthodontic treatment, but they all have one thing in common. They all snore at night. Okay, so that's not why they came to the office, but we found out at the new patient consultation that they snore. So this is Riley. She came to the office when she's 9 years old, and she came because of crowding. So you can see that she just doesn't have a lot of space for her teeth in her mouth. So we took an x-ray and to see the position of her teeth, and she definitely does not have enough space in her mouth. And so if you don't have enough space in your mouth, the teeth are not going to get any smaller, they're not going to disappear, and they're not going to stop and wait. So without any type of treatment, it is possible for her teeth or anybody's teeth to come in like this. This is very common because, like I said, the teeth are going to find a way into the mouth. And once the patients come this way with their teeth like this, it's very difficult. We have to remove permanent teeth and guide those canines back into position. So the goal is to create space before that happens. And we can do that for our young patients because we can separate their suture. The upper jaw is 2 bones separated by a suture. If you remember, if any of you have children, when they were babies, they had a soft spot on the top of their heads. That is just the joining of the bones of their skull. Over time, that calcified and became one bone. So the same thing is going to happen with the upper jaw. The upper jaw is 2 bones, but at a young age, the bones have not joined. So this is where Riley is at. That means that we can separate the 2 bones, create more space, new bone will fill in, and then they will have more space for their teeth. In turn, at the same time, when that happens, the whole floor of the nasal cavity will become wider. If the floor of the nasal cavity becomes wider, total volume increases. If total volume increases, airflow increases. So, for Riley, we use this appliance here. It's called an expander. And it works like this. It is glued in the mouth. And there's a key. This key is turned and the whole upper jaw is separated. This is not a painful process. This does not hurt at all. There are no nerve endings in the suture. So this happens over the course of 3 to 6 months. So it's very comfortable. And then we put a few braces on because we don't need the space there. We need it for the back teeth, right? But remember, when this happens and we get skeletal separation, new bone will fill in. When that new bone fills in, then they have a bigger nasal chamber. So, this is how Riley started her treatment. And just after a few months, this is how her teeth came in. When the teeth have space, they come in very nicely. It's when they don't have space, that's when the problems arise. The second patient here. Now this is Jessica. Now she also doesn't have space, but her problem is her lower jaw is growing faster than her upper jaw. And that's what's caused this underbite. This is what we call an underbite. The bottom teeth are not supposed to fit on the outside of the top teeth. It's supposed to be the other way around. So for Riley, she also, and Riley snores, okay? So for Riley, she has to have an expander, and then she has to wear this appliance. It's called a face mask. She doesn't wear this when she's at school. She doesn't wear this when she goes out. She wears it when she's at home. And the purpose of this is to bring the upper jaw forward. So once again, expander goes in, create more space, loosen up that suture. And then, wears this appliance for about a year to bring the upper jaw forward. I know this seems like a lot. However, if this is not taken care of at a young age, the only way to treat this patient is to surgically treat the patient when they're older, meaning to break the jaw and bring it forward, okay? So, again, this is Riley how she started. After her expander and her face mask, this is how she finished. Again, not a painful process, very comfortable. Look at her teeth. When you bring the upper jaw forward and get the jaws in the right position, the teeth almost take care of themselves. And secondly, look at her face, the position of her upper lip, her profile. So much more balanced now. Before, upper lip was so retrusive, right? After this treatment, Jessica does not snore. Another patient. This is Allison. She has the reverse problem. Her lower jaw is too far behind. Her upper jaw is growing faster than her lower jaw. And her upper jaw is so narrow. And she snores at night. Okay? So, her treatment will be the same, but instead of the upper jaw coming forward, we need to bring the lower jaw forward. Again, because she's growing, this is possible non-surgically. And we use this appliance here after the expander, and it works like this. This appliance is glued in place for about a year. And all it does, it postures the lower jaw in a more forward position. And because the patient is still growing, the lower jaw will grow at the growth site, resulting in a larger lower jaw. Non-surgically, not painful. So you can see before, and then the expander and the jaw corrector, and this is after. Again, when you put the jaws in the right position, the teeth almost take care of themselves. Look at her face, the position of her chin. After her treatment, she stopped snoring. Last patient. This is Lenny. Now, Lenny is 27 years old. He is sent to us by his physician because Lenny is diagnosed with obstructive sleep apnea. He doesn't care much about his teeth, but he has health issues. He's not sleeping well. He's not breathing well. He had to quit his job. So his physician did a sleep study and they found out that he has severe OSA. In order to treat Lenny, we have to make his jaws bigger, his airway bigger. But because of his age, we cannot do this without surgery. So, Lenny's treatment is a bit different. First, let me explain his problem. When he sleeps at night, this whole area, the nasal cavity and this area, is too small. When the tongue and everything falls back, he's waking up at night, choking and coughing because he's not getting that proper oxygen. And if that happens several times a night, you're not going to get a good night's sleep. And then this can lead to serious health issues. So for Lenny, he is on the right side. He needs that expansion, but unfortunately, his suture is closed. So, he comes to our office, we place the expander, and then we send Lenny back to the surgeon, who has to take him to the OR and surgically cut his suture. So the suture is cut, and then he comes back, we turn, we separate, so that the floor of his nasal cavity becomes wider. New bone fills in. Then, after this surgery, Lenny needs another surgery. So braces are put on. And then, we have to open up his airway in the back. So, here is too narrow for Lenny and for a lot of patients who have sleep apnea. So it has to happen, braces go on. And again, we send him back to the surgeon. They have to break both jaws and bring them forward. Then the plates and the screws are placed to hold them in position. And then we finish his orthodontic treatment. Now, I know this seems like a lot, but if you cannot go back to work, if you have to drop out of school, for the women who cannot have babies, this is a small price to pay. So, Lenny before treatment, after treatment, and you can see all the hardware in place. He's doing much, much better. He's back to work. He's healthier. He's happier. His mood is better. So he's very, very happy he did this. So let me go back and explain a little bit about OSA, obstructive sleep apnea. If you're not aware, it is a growing problem. It is killing Americans every single year. They have serious, serious health problems. And it's all related to their airway. Now, we see a lot of patients like Lenny who are adults who are sent to us by their physician because they have to have this surgery in order to take better care of their health. These are patients that have serious health problems, heart problems, diabetes, mental health. Like I said, some patients, they have to drop out of school, they have to quit their jobs. The moms cannot get pregnant, so they need to have this treatment. So when we see our younger patients, our growing patients who come in who have the same skeletal pattern, we want to treat them as early as possible, especially if they snore at night. Because for these patients, these young patients, obstructive sleep apnea, OSA can manifest into a lot of bad things, specifically poor growth, anxiety, depression, but mostly poor academic performance and ADHD. The studies show that 25% of children who are diagnosed with ADHD, the reason for that is due to airway. But they're on medication, they have behavior issues, and it could be fixed another way. This is very, very well documented, in not just the dental literature, but all the medical literature. They perform even better. So airway is significantly important. In our office, we like to say, there's no such thing as too much air. You cannot get sick from too much air. So if you go to several orthodontists, you may get several different plans. you should go with the plan that's going to maximize the airway. So how do you know? How do you know if your child has OSA? Well, I'm not a physician, but this information is very available. Are they snoring loudly and on a regular basis? Do they pause, gasp, snort, or cough in their sleep? Are they always moving positions, or do they sleep in a very awkward position every night? Are they wetting the bed still? Difficulty waking up, daytime sleepiness. Most children are difficult to wake up, but is this happening every single day, even after sleeping 8 to 10 hours? For these children, this problem has to be addressed by several different specialists. Again, I'm not a physician, I'm not a surgeon, but I'm an orthodontist. And what we do as orthodontists can affect the tube from the outside. And then there's the inside. Tonsils, adenoids, allergies, things along that nature. That all makes up the airway, which is all one tube. So I'm going to discuss the orthodontic treatment and what can increase airway volume. We know that when we expand, when we move the jaws forward, we know we open up the airway volume in 3 dimensions. It's not a secret. And even the sleepapnea.org device that rapidly expands the transverse diameter of the hard palate over a 6-month to 1-year period has been used successfully in children as young as 6. And we know this to be true. We see this all the time. When we successfully expand the upper arch and get pure skeletal separation, like I said, the floor of the nasal cavity becomes bigger, increasing total volume, and then increasing airflow. Not only that, if you make the entire oral cavity bigger, the tongue has a bigger space to live. If the tongue has more space, it's going to come forward. That's going to open up airway in the back. Make sense? Second, if we bring the lower jaw forward, like we did for Erin here, you can see Erin has a narrow upper jaw. She has this significant overbite because her lower jaw is so retrusive. So she had an expander plus brought everything forward. This is how we finished her treatment. Look at her teeth. So the overbite is gone, but look at the position, look at her upper jaw. This picture right here. What happens after the expander? Much bigger. And then, when we bring the lower jaw forward, look at the position of her chin. Not only does it look nicer, the tongue and the entire border of the airway is attached to the lower jaw. If you bring the lower jaw forward, that's going to bring the tongue forward. That's going to open up space in the back. Those are all the same exact type of procedures that the surgeon has to perform for our older patients. And we see the airway change all the time. Our patients tell us all the time, after the expander, after the appliance, the child doesn't snore anymore, sleeping better. Like for Amanda here. Amanda needed expansion. We needed to bring her lower jaw forward. This is after her treatment. Watch what happens to her airway. And the volume of a cylinder is pi r squared times height. So if you double the radius of a cylinder, you're going to get a significant change in volume, correct? I ask patients this all the time at the consult. It's surprising that so many young patients don't know the volume of a cylinder. Okay, so this is Kai. Kai just needed an expander, which we did. And you can see the change in his airway volume. Now this is a 2-dimensional image, so it's not entirely accurate, but this is all we have as orthodontists. This is Emmy, so she has a narrow jaw and an underbite, so she needed to bring her upper jaw forward with the expander after her treatment, and you can see the before and after. Eva, again, she needed expansion, lower jaw comes forward, this is afterwards, and the difference. And this is Derek, same treatment plan, not much change. However, Derek's mother said before his treatment, he could only play 5 minutes in his soccer game before getting tired, out of breath. after the treatment, she says that he could play the entire game without any issues. I'm not suggesting we're making miracles, but nobody ever says the breathing gets worse. And like I said, there's no such thing as too much air. And this is Jeffrey. Jeffrey came in, he did an expander, and before and after. Jeffrey and his sister are professional figure skaters, both treated with an expander in our office. And Jeffrey's sister has won national titles and also skated for the US national team in Korea last year. We like to joke in the office that her success is due to her expander. So when is the right time? So the AAO recommends every child be evaluated for orthodontic treatment by age 7. I believe in that, except there are patients who are under age 7 who are snoring very, very deeply, like this young man here, age 5. Look how small his upper arch is. Underbite, snoring every single night. Parents are more concerned about the airway than the teeth, and I can understand that. So, for this young man, even though he has all baby teeth, no permanent teeth, we put an expander in. And look what happens. So you can see the middle picture down here. After the expansion, space opens up. 2 weeks of expansion, snoring stops. And then he has to wear this appliance to bring the upper jaw forward, which happens very quickly because at this age the bone is very soft. And done. This is my son. So, yes, age 5 is very young to start treatment, but he's my son and I can do whatever I want to him. And I would do it again in a heartbeat because his snoring stopped. My daughter, who is 4, also snores. When she turns 5, she's getting the same thing. So, like I said, you can have many, many different options with your orthodontic treatment. If your child is in treatment, you should have this discussion with them. If they're snoring every night, you should talk to the orthodontist about what the options are. Thank you, everybody. Thank you for bringing me. Thank you for allowing me to present. And are there any questions?
请问大家有问题吗 ？Any question there?
So the question is, when was the expander introduced? 40, 50 years. Now, it has changed. It has changed. So that's a very good question. It's very important for the orthodontist to recognize what the best expander is. There are so many different expanders, and some expanders are not going to achieve that same skeletal separation that is necessary to open up the airway. There are expanders that just push the teeth out. Pushing the teeth out is not going to achieve the same results. So, it's the responsibility of the orthodontist to recognize that. Oh yeah, once the expansion is done, then the new bone fills in, then the expander is out. We keep expanders in maybe 3 to 6 months. Yes?
For people over 60 years old, do you still recommend to have their heart palate open by surgery?
That is a very good question.
A lot of people have OSA.
Absolutely, absolutely. So, again, I'm not a physician, but a lot of it is going to depend on the severity of OSA. And this applies to not just people who are 60, but people who are 18 to 80, it doesn't matter. Depending on the amount of OSA, which is dictated by a sleep study, the severity, it will change the plan. Now, if it's extremely severe, yes, surgery is the best option. However, every surgery has its risks. And as patients get older, those risks become more risky. So, this is a discussion to have with the surgeon because there are pros and cons to all the different kinds of treatment. Now, it's really kind of a decision for the patient and the physician to make. There's a CPAP machine. I know a lot of adults who prefer not to have surgery, so they sleep with a CPAP. My 2 brothers both have OSA. They both sleep with a CPAP. Does that answer your
We
question?
take the last question. So who's going to?
That side?
Sure.
Sorry.
We know that orthodontic procedure is considered as a cosmetic surgery or procedure, so it's not a tax deductible option. But I'm glad that you mentioned that it could be related to the sleep apnea. So in case we could get doctor's certificate approval, could that be claimed as a tax deductible?
Very, very good question. So, if surgery is needed, that type of surgery is covered under medical insurance, if approved. Now, the orthodontic treatment, even if the surgery is approved, is not. It's still out of pocket, or to use a HSA fund or a FSA fund to use. A lot of insurance plans, dental insurance plans, offer an orthodontic benefit. It's usually a lifetime, one-time lifetime benefit, but that's all. None of the orthodontic portion falls within the medical.
Wow, awesome. I think we are so lucky to have Dr. Samuel with us today, sharing such a professional and expertise, valuable information. We are very impressed. I'm sure everybody is so happy to have this today. Thank you so much. 谢谢。是谢谢。我们还有一个这个协办单位Willingly 好。那我想我们的时间到这里为止，不晓得大家还有什么样的问题要对我们这个主办单位有什么建议？欢迎你们全部都提出，好的坏的我们都欢迎。谢谢你们。